Universal health care is a highly controversial topic in today's political arena. Currently, congressmen are working diligently to pass a bill that will enact a government-run insurance agency. The concept of enacting a revolutionary overhaul in health care for an entire nation is complex, to say the least. A change so monumental deserves adequate consideration of all the possibilities for potential problems and should allow time to provide these solutions. Yet President Obama is constantly applying pressure on Congress to hurriedly forge and pass this bill, thus leading to the question, should a universal healthcare system even be implemented in the United States? This question is answered by analyzing the healthcare system of the United States military, Medicare and Medicaid, and the economic impact of a prospective system. The United States is not without universal healthcare influence. The United States military implements a similar system called TRICARE. This system offers an affordable and viable healthcare plan to retirees and the family members of those serving. One of the important aspects many consumers are quick to consider is cost. For active duty members, the cost of enrollment, behavioral health of both inpatient and outpatient, emergency room visits, hospitalization, and outpatient visits are no cost. However, when the active personnel retire, the costs begin to appear. In comparison to the cost for the non-listed population, these prices are still excellent. However, the government absorbs most of the costs of TRICARE. Another aspect to take into consideration is the efficiency of the Department of Veteran Affairs. The VA is designed to administer benefits and services to veterans and their dependents as well as the veterans' beneficiaries. One problem is that the retirees must annually report to the VA or risk being dropped from the system. If someone is dropped from the system, they must complete the required paperwork and spend hours waiting to be re-entered into the system before someone can receive even an influenza vaccination. Another problem is that the VA is backlogged with approximately 1 million unfinished disability claims. As a result of this crisis, veterans are now forced to wait an average 6 months in order to receive disability benefits. In some cases where disabilities have been denied, veterans are waiting up to 4 years in order to come before a court to appeal the decision. In the United States, laws are in place prohibiting health insurance from being sold nationwide. This restricts the market of health care to within individual states. As a result, people are limited to which health insurance options they can receive from the agencies in their area. This barrier prevents competition and keeps the prices of health care high. Auto insurance is a prime example of nationwide insurance competition. Allstate and State Farm compete with the promise of keeping you insured after an accident, while Geico and Progressive constantly compete to provide insurance at the lowest cost. These companies offer affordable coverage, including perks associated with choosing each particular insurer. The businesses compete to lower the cost of their service while increasing the quality. Consumers win with competition. The government option will offer nationwide health care to anyone in the United States at a price that is below the average cost. Although this sounds great for the pocketbooks of Americans, it will have a negative effect on the health insurance market. The government is not a new competitor in health insurance. It is a potential natural monopoly. A natural monopoly is when one firm can meet the entire market demand at a lower average cost than 2 or more firms could. When the government offers insurance at a lower price, companies will have to lower their prices in order to stay competitive. Now, this price could be below the firm's total cost of supplying health insurance. If this is the case, then the companies will be incurring losses. Over a period of time, these companies will not be able to compete against the government, who offers nationwide insurance that is cheap. The government can consume the losses and add their deficit to the already growing national debt, which is pressing at $12 trillion. Private insurance will eventually be unable to compete with only a limited population to supply and barriers against merging together. This leaves the public with only one remaining option: government insurance. Projected cost of healthcare reform is estimated to be $900 billion over a 10-year period. Now, this price tag was accomplished by expanding Medicaid benefits to a larger population and making adjustments to Medicare. Senator Lamar Alexander from Tennessee announced, "We are cutting Medicare $500 billion, and instead of spending it to strengthen the Medicare program, the proposal is to spend it to create a new entitlement program." 43% of the government's budget is already allotted to Social Security, Medicare, and Medicaid. Bob Weiner, former Chief of Staff for the House Committee on Aging, projects that the Medicare will run out of money by 2017, with Social Security following only a few years later. This is due to 2 problems. 1, Congress has been using the surplus of money from the Medicare and Medicaid account to fund miscellaneous bills over the past decades, and 2, the baby boomers are now beginning to cross the Medicare threshold. Physicians are not too fond of the government's Medicare and Medicaid payments. The majority of private doctors exhibit frustration with the government over the lack of reimbursements for services credited to Medicare and Medicaid. Many private physicians are choosing not to accept new patients who wish to pay with Medicare, with one reason being that these reimbursements are insufficient. The Medicare reimbursements, however, are better than those of Medicaid. Medicaid paid physicians 72% of Medicare rates for the same services in 2008. If the government's existing healthcare services are failing physicians and recipients, the possible outcome of a nationwide system for all Americans is potentially catastrophic.
Another issue is the 47 million people that are either uninsured or underinsured. Now, when the government gives these people the approval to go out and use their new insurance, hospitals will be overfilling. There is a lack of facilities, equipment, doctors, nurses, and administrators in order to sustain the significant increase in patients. This will result in increased waiting periods to see doctors with a quality of care that will be substantially less than current service. In order to offset the numerous patients, doctors will be rushed to diagnose and administer treatment. This is not a good combination with an impending increase in work hours. The United States is not capable of sustaining an efficient, adequate, or financially neutral healthcare system. The financial and economic repercussions of a potential universal healthcare system would disappoint the expectations of citizens. The market structure of health insurance will be threatened by the addition of an unregulated government with regulated competitors. The United States government will be unable to financially support the millions of prospective clientele, along with the millions of Medicare and Medicaid beneficiaries. Military healthcare, Medicare, and Medicaid display the inadequacies and inefficiency associated with government involvement. These shortcomings are not characteristics a rational consumer would be satisfied with when looking to buy health insurance. Instead, measures should be taken to allow insurance companies to compete on the national level. The government should also provide assistance to small businesses, allowing them to have an increased opportunity of offering health insurance to their employees. This initiative would allow for the market to correct itself without substantial government involvement.